Okay, so here is a video on how to do some self-rehab on your glute med and glute min. So these are the smaller muscles of the glutes. So we all know the big one right here that's on the outside, but we have small little kind of accessory kind of muscles to the big glute that sometimes can become strained or tight. So I'm going to show a video, an exercise using the lacrosse ball to help work through some tightness on these small muscles. So I'm going to hand the video now to my lovely assistant. So here you go. So what we're going to do is, if you want to come on over this way and get the angle. So we have a lacrosse ball. What we're going to work to do is, on the chart, we showed where those little muscles are on the side of the hip. So it's not our big glute. It's actually up in this region in here, up by where the crest of the hip bone is. So we are going to take a lacrosse ball and actually create pressure in that area. And then we're going to try to grind into the muscle with pressure to get the muscle to relax. So this treatment is often for if someone strains one of these muscles in a protective mechanism, the body will then tighten the muscle down. So we want to coax the body to let it loose. So if the body locks it down and then it stays tight for days on end, the body actually kind of forgets to let it go. So if we create pressure with a lacrosse ball into that area, the body registers that the muscle is tight, and then it can, after we remove the pressure, work to release some of that tension and tightness. So this is really helpful for anyone if they have a strain in one of these muscles that's causing pulls and strains in other areas related to that muscle as a protective. So we're going to take the lacrosse ball. I'm actually going to lay on the floor, and I'm going to be using my own body weight to kind of create the pressure. So I'm going to take the lacrosse ball, find where my area of pain is. I want to put the ball there and then roll onto it. I can apply some body weight pressure if that's enough to feel uncomfortable. And then once I have that pressure, I can then kind of move myself up and down along the line of the muscle, or I can create pressure and create movement by extending my leg. If I need more pressure, I can then turn more and put all of my body weight onto the muscle. I'll support myself with my other leg, and again, I can grind up and down to create pressure into the muscle, or I can move my leg like this. The idea is to only do this for about 30 to 60 seconds to create that pressure in the muscle. Then, when we stand back up, the body will re-register how tight it needs to make that muscle for protective purposes, and often it allows it to actually release from when it first tightened due to the injury. So 30 to 60 seconds in that pressured area. Again, you can grind over top or you can pin it down and create movement. So give that a try and see if it helps.